Headaches represent one of humanity's most universal medical experiences. Nearly everyone will experience a headache at some point in their lifetime, with the World Health Organization estimating that approximately 50% of adults worldwide have experienced at least one headache within the past year. Despite their commonality, headaches often trigger significant anxiety, that persistent worry about whether your pain signals something serious or dangerous lurking beneath the surface. Understanding the specific characteristics of your headache is actually the first step toward proper treatment, explains Dr. Emily Parker, a neurologist specializing in headache disorders at the University Neurology Center. The location, quality, intensity, and accompanying symptoms create a distinctive pattern that helps identify the underlying cause. This comprehensive guide will explore the major headache patterns that affect most people, examining their distinctive features, potential causes, and appropriate responses. By recognizing your particular headache signature, you can better determine whether your pain warrants simple home treatment, lifestyle adjustments, or immediate medical attention. Knowledge truly becomes power when it helps distinguish between common, manageable conditions and those rare situations requiring intervention. Let's explore the most prevalent headache types, organized by their characteristic patterns and locations, to help you become more informed about this nearly universal experience. Tension headache is the everyday burden. The most common headache type affecting up to 80% of the global population is the tension headache. Often described as feeling like a tight band wrapped around the head, this headache typically manifests as bilateral pain, occurring on both sides simultaneously, concentrated in the temples and forehead. Some patients also report discomfort radiating to the crown of the head, or even extending down to the neck. Tension headaches earned their name because they originate primarily from sustained muscle contraction in the head, neck, and shoulders. Dr. Parker explained, imagine these muscles gradually tightening like a slowly constricting band, creating pressure against the skull that registers as pain. The intensity of tension headache typically ranges from mild to moderate, uncomfortable enough to disrupt concentration and productivity, but rarely debilitating enough to completely halt daily activities. This distinguishes them from more severe headache types that can render sufferers temporarily incapacitated. Additionally, tension headaches generally don't worsen with physical activity like climbing stairs or bending over, which helps differentiate them from certain other headache types. The primary triggers for tension headaches reflect the stresses of modern life. Emotional tension, inadequate sleep, poor posture, particularly during extended computer work, eye strain, and dehydration. This connection to lifestyle factors explains why tension headaches often appear during particularly demanding work periods or times of heightened emotional stress. Managing tension headaches, simple but effective approaches. Relief from tension headaches often comes through straightforward interventions that address the underlying muscle tension. Gentle massage targeting the temples, neck, and shoulders can help relieve the contracted muscles causing the pain. This approach works by improving blood flow to tense areas and interrupting the pain spasm cycle that perpetuates discomfort. Emma Thompson, a 30-year-old marketing executive, found significant relief through regular self-massage techniques. I keep a small massage roller at my desk, and when I feel that familiar tightness building, I spend just 2 minutes rolling the back of my neck and shoulders. It's remarkable how often this prevents a full-blown headache from developing. Topical treatments containing menthol, camphor, or similar ingredients create a cooling or warming sensation that can distract from pain signals while improving local blood flow. These are available as roll-ins, balms, or adhesive patches that can be applied directly to tense areas. Over-the-counter analgesics like acetaminophen, Tylenol, or ibuprofen typically provide sufficient relief for moderate tension headaches when used as directed. Prevention remains the most effective approach to tension headaches. Regular stretch breaks during prolonged computer work, proper ergonomic setup for workstations, stress management techniques, adequate hydration, and consistent sleep patterns can significantly reduce the frequency and severity of these common headaches. Migraines, the neurological storm. The second major headache category, migraine, affects approximately 12% of the population worldwide, but accounts for a disproportionate amount of headache-related disability. Unlike tension headaches, migraines typically manifest as unilateral pain, affecting only one side of the head, though in some cases, the pain may eventually spread to encompass both sides. This distinctive one-sided pattern serves as an important diagnostic clue. Migraines represent far more than just severe headaches. Dr. Parker emphasizes, they are complex neurological events involving changes in brain chemistry, blood, vessel dynamics, and inflammatory responses. Think of them as electrical storms moving through the brain. A defining characteristic of migraine pain is its pulsating or throbbing quality, often described as synchronizing with the heartbeat. This vascular component explains why physical exertion typically worsens migraine pain. Activities that increase blood flow and pressure, such as climbing stairs or bending over, intensify the throbbing sensation experienced during an attack. Duration represents another crucial diagnostic feature, with migraines typically lasting between 4 and 7 to 2 hours without treatment. This extended time frame contrasts sharply with tension headaches, which may persist for hours but rarely continue uninterrupted for multiple days. The intensity of migraine pain also distinguishes it, ranging from moderate to severe, often reaching a level that renders normal functioning impossible. The migraine experience beyond just head pain. What truly sets migraines apart from other headache types is their multisensory impact. Approximately 1/3 of migraine sufferers experience what's called an aura, a collection of neurological symptoms that typically precede the headache phase. These temporary neurological disturbances most commonly manifest as visual phenomena, flickering lights, zigzag lines, blind spots, or shimmering visual distortions that develop gradually over 5-20 minutes. My aura starts as a small blind spot that expands into a crescent of flashing, colorful zigzags, describes Michael Chen, a 40-year-old architect who has managed migraines for over 15 years. It's like looking through a broken kaleidoscope that gradually overtakes more. When my vision, I see it starting, I know I have about 30 minutes before the pain begins. Beyond visual disturbances, migraines frequently involve heightened sensory sensitivity. Photophobia, extreme sensitivity to light, and phonophobia, a sensitivity to sound, occur so commonly that they're included in formal diagnostic criteria. Ordinary room lighting becomes painfully bright, and normal conversation volumes can seem unbearably loud. Many sufferers seek refuge in darkened, quiet rooms until the attack subsides. Gastrointestinal symptoms frequently accompany migraines, with nausea affecting up to 90% of patients, and vomiting occurring in about 1/3. These digestive disruptions further contribute to the debilitating nature of migraine attacks and may complicate treatment by interfering with oral medication absorption. Migraine management, a multifaceted approach. Managing migraines effectively requires a comprehensive strategy encompassing both acute treatment and preventive measures. For acute attacks, specific migraine medications called triptans have revolutionized treatment by targeting the underlying vascular and inflammatory mechanisms. These prescription medications work most effectively when taken at the earliest signs of an attack. The timing of medication is crucial with migraines, notes Dr. Parker. Research consistently shows that interventions applied during the early phase of an attack produce better outcomes than those delayed until pain becomes severe. Non-pharmacological approaches play an important complementary role. Many patients benefit from implementing consistent sleep schedules, regular meals, stress management techniques, and trigger avoidance. Common migraine triggers include certain foods, aged cheeses, processed meats, alcohol, hormonal fluctuations, weather changes, strong odors, and disrupted sleep patterns. For those experiencing frequent or particularly debilitating migraines, preventive medications may be recommended. These are taken daily regardless of headache status and aim to reduce the frequency, severity, and duration of attacks. Options include specific antihypertensives, antidepressants, anticonvulsants, and newer targeted treatments like CGRP antagonists developed specifically for migraine prevention. Sinus headache is the inflammatory pressure. The third major headache pattern affects the frontal region, a forehead, and extends into the areas surrounding the nasal cavity. This distinctive location pattern, combined with specific aggravating factors, characterizes sinus headaches, pain resulting from inflammation and pressure within the paranasal sinuses. True sinus headaches are less common than many people believe, explains Dr. Carr. Many headaches attributed to sinus problems are actually migraines with nasal symptoms. However, when sinus inflammation does cause headaches, the pattern is quite distinctive. The pain of genuine sinus headaches concentrates in the regions directly over the affected sinuses, typically the forehead, frontal sinuses, or the cheeks and bridge of the nose, maxillary sinuses. Unlike other headache types, sinus headaches exhibit a strong positional component. Bending forward typically intensifies the pain significantly as it increases pressure within the already inflamed sinuses. Accompanying symptoms provide important diagnostic clues that differentiate sinus headaches from other types. Nasal congestion, thick nasal discharge, often discolored, reduced sense of smell, and sometimes fever typically accompany true sinus headaches. These symptoms reflect the underlying inflammatory process affecting the sinus cavities and surrounding tissues. The primary causes include viral or bacterial sinus infections, allergic reactions, and anatomical issues that interfere with normal sinus drainage. The resulting inflammation creates pressure within the confined sinus spaces, which registers as pain in surrounding structures. Addressing sinus-related head pain. Treatment for sinus headaches necessarily targets the underlying inflammatory process, rather than just addressing the pain itself. Decongestants, oral or nasal spray formulations can provide temporary relief by reducing swelling and facilitating drainage. Saline nasal irrigation using neti pots or similar devices helps flush irritants and excess mucus from the nasal passages, potentially alleviating pressure. James Wilson, a 30-year-old teacher with seasonal allergies, manages his recurring sinus headaches through a combination approach. I've learned that prevention is crucial for me. During allergy season, I use daily saline rinses and an antihistamine nasal spray prescribed by my doctor. If I feel pressure building, despite these measures, warm compresses across my sinuses often provide. For cases involving bacterial infection, antibiotics may be necessary. However, most sinus inflammations result from viral infections that don't respond to antibiotics. In these situations, symptom management becomes the priority while the infection resolves naturally. Chronic or recurrent sinus headaches sometimes indicate structural issues that impair normal sinus drainage, such as nasal polyps, deviated septum, or chronic sinusitis. In these cases, evaluation by an otolaryngologist, ear, nose, and throat specialist may be warranted to address the underlying anatomical factors contributing to recurring inflammation. Ocular eye-related headache. As the vision connection A, particularly concerning headache pattern involves intense pain localized around or behind one eye, often described as sharp stabbing or burning in quality. This distinctive pattern, especially when accompanied by redness in the affected eye, raises important diagnostic considerations that sometimes require urgent attention. Eye-related headaches span a spectrum from benign to potentially sight-threatening. Dr. Parker explained, the combination of severe eye pain, redness, and headaches should always prompt relatively urgent evaluation, particularly if it's a new or unusual pattern for you. One serious condition presenting this way is acute angle closure glaucoma, a sudden increase in intraocular pressure that can damage the optic nerve if not promptly treated. This medical emergency typically causes intense pain around or behind the eye, redness, blurred vision, halos around lights, and sometimes nausea and vomiting. Immediate medical attention is essential, as delays in treatment can result in permanent vision loss. More commonly, eye strain from prolonged screen use, uncorrected vision problems, or eye dryness can trigger headaches centered around the eyes. These typically respond well to rest, artificial tears, and addressing any underlying vision needs. Regular vision checks and proper computer ergonomics can help prevent these tension-type ocular headaches. Cluster headaches, though relatively rare, present with excruciating pain centered around one eye, often accompanied by tearing, nasal congestion, and restlessness. These extremely severe headaches typically occur in cycles or clusters, lasting weeks to months, followed by remission periods. Their intensity has earned them the unfortunate nickname, suicide headaches, reflecting their devastating impact. Trigeminal neuralgia, the facial lightning moving beyond the skull itself. Some headache patterns primarily affect the face, rather than the head proper. The most distinctive of these facial pain syndromes is trigeminal neuralgia, an intense, electric shock-like pain that follows the distribution of the trigeminal nerve across the face. This distinctive pattern causes some of the most severe pain known in medical practice. Trigeminal neuralgia creates a very specific type of facial pain that patients describe in remarkably similar terms. Notes Dr. Parker. They often say it feels like lightning striking their face, or like being stabbed with a hot poker. The intensity is typically off the charts. The pain of trigeminal neuralgia follows one or more branches of the trigeminal nerve, affecting the forehead, eye, cheek area, or jaw, chin. What distinguishes this condition is its trigger sensitivity. Even minimal stimulation like a light breeze across the face, applying makeup, shaving, or eating can provoke excruciating pain episodes lasting from seconds to minutes. Most cases of trigeminal neuralgia result from blood vessel compression of the trigeminal nerve near its connection to the brainstem. This creates abnormal firing patterns that generate the characteristic shooting, electric pain. Less commonly, the condition may result from multiple sclerosis, tumors, or injuries affecting the nerve. Treatment typically involves medications that stabilize nerve function, such as carbamazepine or gabapentin. For cases that don't respond adequately to medication, several surgical approaches can address the underlying compression or modify the nerve's function through controlled lesioning techniques. Cervicogenic headaches. When your neck is the source. The final major headache pattern will explore presence as pain in the occipital region, the back of the head, and upper neck. This location pattern often indicates cervicogenic headaches, which originate from structural problems in the neck rather than primary headache disorders. Or modern lifestyle with hours spent looking down at phones and computers has made neck-related headaches increasingly common, explains Dr. Carr. The upper cervical spine and its associated muscles and nerves share intimate connections with pain processing pathways affecting the head. Cervicogenic headaches typically begin in the neck and radiate forward, sometimes reaching the forehead, but usually most intense at the base of the skull. The pain often feels dull, aching, or pressure-like and may worsen with specific neck movements or sustained awkward positions. Many patients report that the pain begins after prolonged computer work, driving, or other activities that place strain on the neck. The underlying causes typically involve degenerative changes in the cervical spine, joint dysfunction, disc disorders, or chronic muscle tension patterns. Poor posture significantly contributes to many cases, creating abnormal loading patterns that strain the upper cervical segments over time. Physical examination often reveals tenderness in the upper cervical joints and surrounding muscles, limited neck mobility, and reproduction of headache symptoms with certain neck movements or pressure at specific points. Addressing neck-related headaches, treatment for cervicogenic headache centers on resolving the underlying neck issues, rather than simply managing the headache symptoms. Physical therapy focusing on proper alignment, muscle balance, and joint mobility often produces significant improvement. Specific exercises targeting the deep neck flexors and upper back muscles can address postural contributors to pain. Sarah Johnson, a 40-year-old software developer, found relief after a comprehensive physical therapy program. Years of hunching over my laptop had created this pattern of recurring headaches. My physical therapist taught me specific exercises and postural corrections that made a dramatic difference. I still have occasional episodes when I'm working intensely, but I now have tools to address them before they become severe. Ergonomic modifications represent another crucial intervention, particularly for those whose work involves prolonged sitting or computer use. Proper monitor height, supportive chairs, and regular movement breaks can prevent the sustained postural strains that contribute to cervicogenic headaches. For cases involving significant joint dysfunction, gentle mobilization techniques performed by physical therapists, chiropractors, or osteopathic physicians may provide relief by restoring normal movement patterns. More persistent cases sometimes benefit from interventional approaches like medial branch blocks or radiofrequency ablation targeting the nerves that transmit pain from the affected cervical structures. When headaches warrant medical attention, while this guide covers the most common headache patterns, certain warning signs should prompt medical evaluation. Dr. Parker emphasizes several red flags that shouldn't be ignored. Seek immediate medical attention for what we call thunderclap headaches. Severe pain that reaches maximum intensity within seconds to minutes, especially if it's unlike any headache you've experienced before. This pattern occasionally signals serious conditions like subarachnoid hemorrhage. Other concerning features include headaches that consistently wake you from sleep. New headache is developing after age 50. Headache is accompanied by fever and stiff neck, pain that worsens with lying down, changes in mental status or personality, and headache is following head trauma. For existing headache patterns, changes in frequency, intensity, or character also warrant evaluation. Your established headache pattern serves as your baseline. Dr. Parker explained, significant deviations from this pattern deserve medical attention, as they may indicate an evolving condition or complication. Conclusion: knowledge is power in headache management. Understanding your specific headache pattern provides both practical guidance for management and peace of mind regarding its significance. The vast majority of headaches, while uncomfortable and disruptive, don't represent dangerous underlying conditions. Most patients find tremendous relief simply in understanding what type of headache they're experiencing. Dr. Parker observes, this knowledge reduces anxiety about potential serious causes and empowers them to implement appropriate management strategies. Through recognizing your particular headache signature, its location, quality, intensity, triggers, and associated symptoms, you gain valuable insights that guide effective treatment approaches. This understanding allows you to address not just the pain itself, but the underlying factors contributing to your headache experience. Whether you're dealing with tension headaches from life's stresses, migraines with their complex neurological features, inflammatory sinus pressure, or structural issues originating in the neck, targeted approaches based on accurate identification offer the best path to relief and prevention. Remember that headache management often requires a multifaceted approach combining medical treatments, lifestyle modifications, stress management, and sometimes physical interventions. Working with healthcare providers to develop a comprehensive strategy tailored to your specific headache pattern provides the strongest foundation for long-term headache control.